All right, we're on. You ready?
Ready?
All right, let's do this. What's good, everyone? This is Dr. Nee.
And Dr. Renee.
We're still alive, y'all. So I think people have been following us, mainly following you. And if they follow you, they know that you got infected by COVID-19, or as we say on the streets, that Rona.
The Rona. Mm-hmm.
My Sharona.
No.
No?
No. This is not a joke, man. This is, we're laughing, but we do know that, we actually do know a couple of people who died.
Yeah.
Because of this virus. And it just hits you so hard. It's so bad. It's so bad, guys. Oh my gosh. If you haven't gotten this, if nobody in your family's gotten this, please stay safe. This is bad.
I agree. So this is the first episode that I've put out in about 2 weeks, mainly because I've been recovering.
Mm-hmm.
And, so basically the timeline is I was in an area where COVID was, it wasn't like as bad as New York and New Jersey.
Not at all.
But you had to be careful. And then I was washing my hands 20 seconds at least. I had ashy hands, ashy fingers. That just comes with the territory. You know what I'm saying? Calling me ashy Dr. Nee. And because I was washing my hands so much, that's what comes along the territory, right?
Right.
Do they still have those antibacterial lotions? I know the hospital I had, they didn't have it. But anyway, that's a side note. It's a side note.
Mm-hmm.
But anyway, I had ashy hands. I was doing everything you're supposed to be doing. And then I got home. And then once I got home,
You're actually fine.
a couple of days later, I just wasn't feeling right. I just started off by having some myalgias, and then, just not feeling right. And then there was one night where literally I felt like, I don't know how to explain it, but it was just like I had this huge headache. All of my bones were killing me. I had night sweats, and I couldn't sleep the entire night. And finally, that feeling or whatever I was feeling, and I don't even know if I had a fever. I didn't even check my temperature. I didn't even really want to know. But all I know, I went to bed around like 4 a.m. and then woke up several hours later and I felt a little bit better. Mm-hmm. But I don't know if you remember, I came downstairs and I was like, I just don't feel right.
Right.
And then you started to have symptoms.
My symptoms were like, so you guys gotta, so here's the thing is that this is all in like hindsight, right? Like a lot of this is in hindsight because you've had night sweats for years.
Right.
So you having night sweats is not that big a deal, right? Because somebody listening to this for the first time might be like, oh, well, if you had night sweats, then you knew you had it. It's like, no. You don't understand. Dr. Nee.
I've had night sweats since I've been in college.
Right. So it is.
It was attributed to, well.
We don't know.
Yeah.
We still don't know. But you've had night sweats for years. So it is not uncommon at all.
But I got a whole workup.
Well, yeah. But it's not uncommon at all that you put a towel down, during the night when you sleep. So, and I'm just saying that, I'm just being a little more specific so that people understand that a lot of these symptoms sometimes you don't realize it's going on until you're like full-fledged in it, and then you look back in hindsight and that's when you realize, holy crap, either I have it or I had it. And I think for you that's kind of where we are.
Yeah, because I didn't get tested because I didn't see a point of getting tested because I wasn't going anywhere anytime soon. So I was just going to self-quarantine myself. And then a couple of days later, you weren't feeling too well. And you want to take it from there?
But what did I have? I had like a headache. I went to work. I had a headache for the most part. It was just like, okay, I got a post-call headache. Like, I always get post-call headaches. So that was, no big deal. But it was on the third day and it just so happened that's when we found out that we actually had a positive exposure in the household. By that time, I was at work. Most that I had was mostly just like a headache. And then after that, the night sweats started. As soon as I found out that she was positive, that same night, I soaked through my sheets. And that same night, remember we talked on the phone because I was off doing a locums assignment. We found out that my infant had a fever. And that's when we just figured out, yeah, most likely we're positive. I got tested the next day. 24 hours later, found out I actually had a positive test.
So let's talk about that test though.
Oh my God.
Because people don't know. So this is like, so now they have some drive-through, oral swab type things. Thank goodness. But
Thank goodness.
Maybe thank goodness. But you had the old school, like straight up nasopharyngeal biopsy.
Yeah, pretty much.
ENT examination.
Pretty much. Oh my goodness. She did my left nostril first. And I don't know why, but for some reason, I just didn't expect for her to go that far. It felt like someone was drilling a hole in my head through my nose. Like, it was so horrendous. Like, that test is so horrendous. And I'm not squeamish at all. But I after she did that nostril, like, first of all, I was like grabbing her hand, like, I just told her I needed a minute, and then she did the second one, and again, the feeling was just so horrendous, and my nose just started bleeding profusely.
Yeah, I know you videoed with me, and I was like looking at your tissue.
Yeah,
we duoed together, and I was like, "Damn! Like, how much blood came out of?"
Yeah, and that was the blood after I left the tent. That was the blood that you saw once I got in the car, but there was way more blood when I was in the testing tent. And I just thought...
Yeah, once I saw you then, I was like, yeah, I'm not getting tested.
Yeah.
I was like, I think I'm good.
At one point, I just felt like, I'm going to stay in the ER just because I have a nosebleed,
you
like
it was
bleeding so profusely. But anyway, what I didn't tell you is, like, after I hung up from you and my nose was still kind of bleeding and stuff, like, I got really, really scared. Like, I started crying. I started thinking about my children. I started thinking about, what if I'm susceptible and I just don't even know it, because you just don't know how this thing is going to affect you, right? You think you're young and healthy, and there are plenty of people who thought they were young and healthy and didn't think that they had any, susceptibility to death, at least, and unfortunately perished. And that was one of the things that I started thinking about, and I had to think about whether or not I was going to come home, because I was out of state, about a 2.5 hour drive away. And, but I made the decision to come home because I felt like I did not want to be out of state should I need to, go to the hospital. So, I made the decision to come home, and, the next 7-8 days after that was just fevers and chills.
But you got better though for a little bit, right? Like there was a point where you got about better.
No, it's not that I was better. What happens with this is, at least in my experience, it wasn't that I was better. It was that I was taking Tylenol and I was intermittently feeling like okay. You see what I mean? Like, it wasn't that I was better. I was just intermittently feeling okay. So I would, wake up in the morning, my shirt would be completely soaked, or in the middle of the night, my shirt would be completely soaked. And then I would get up in the morning, I'd feel like really bad body aches. I'd take a Tylenol. And once I took the Tylenol, about a half an hour later, I felt okay. Like I could function. I could actually function. But then you fast forward about maybe 5 hours into it, or 5 or 6 hours into it, then I was back to the chills. And the chills actually is what really got to me, especially during the day. The chills it was just almost painful because you already have myalgias, and then you're shaking on top of it. And now you can't think about anything else except the fact that you're shaking and you're freezing. So then I would take another Tylenol and then I would be okay.
Yeah, I still wasn't raising the temperature in the house though.
Huh?
I still wasn't raising the temperature on the thermostat. Yeah, we try to save some money.
Anyway, raising the temperature wouldn't have helped anyway. Like I put so many blankets on me, it didn't
I
help.
saw you
What
try to
helped was
creep that. You try to go up
Tylenol.
to like 70 degrees,
Get
man.
out of here. Anywho, what's wrong with you? But no, like it was just bad. Like the taste in my mouth was horrible, horrible. Like I describe it like dirty salt. That's what it tasted like, and I just
Like a dirty
honestly.
martini. Have you had one of those?
No, I haven't had a dirty martini, but if it sounds anything, if it tastes anything like a dirty martini, I never want to have a dirty martini. I mean, the taste in my mouth was so bad. My appetite was completely suppressed. I couldn't smell anything, and you're now with an illness where you need to make antibodies, you need nutrients in your body, but you don't want to eat. And so I had to just kind of forcefully get myself to eat, regardless of the fact that it just tasted so bad in my mouth, because I just knew that if I stopped eating, that I was not going to fare well. Like I literally was forcing myself to eat. It was that bad, that bad. The one symptom I never got was the cough. I never got a cough ever. And, towards the end, when I started having shortness of breath, not having the cough actually concerned me a little bit more, because I was like, well, I'm not expelling anything. You know what I mean? I'm not expelling anything. Like I felt like, okay, now I have shortness of breath. This thing is obviously in my lungs, but my body is not doing anything to reject that. It's not doing anything to expel it from my lungs. I don't know if it's just sitting there. Like, I don't know. So that really just concerned me, because I felt like, the normal response that you should have to an infection in your lungs, I was not having.
Mm. Yeah. Yeah.
It's kind of like you have an allergen, but you don't sneeze. Like, why? Why wouldn't you sneeze? So that was kind of like my thought. You just start thinking about a whole bunch of things, and because that this thing is so deadly, and every day you're hearing more and more people died, and not just on the news, but like people that or people, who, other people who know other people. So you start just kind of thinking all of these things about like, okay, today is like this, but is tomorrow going to be worse?
Mm. Mm.
So
Now, was there ever a point where you're like, look, this is it. Like, I need to go to a hospital.
Mm-hmm. Yeah, I think that was probably day 8. I don't know. On that day, I hadn't had any shortness of breath before that, but on about day 8, I woke up and I was just like, something's not right. Like I'm like pulling for air a little bit more. I'm like literally pulling for air where I wasn't pulling for air before. And I don't know if you remember, I went down to the kitchen to you and I was like, I don't know. I was like, my breathing is a little bit funny today. I just couldn't catch my breath. Like that's how it first started. It's like, I just can't catch my breath. It wasn't so much shortness of breath, like, like I was panting or anything, but I just couldn't catch my breath after just like a little bit of activity. And then the next day was when I was like, okay, definitely now I'm like progressing into shortness of breath. And that's when I was like, I think I need to go to the ER. And then you suggested urgent care, and then what did they tell you?
Don't come here. It's like, if you're positive, so urgent care, at least the one that we went to, were like, called and said that if you are positive, don't come here. Mm-hmm. Don't come around here. Get. You need to go to the ED. So at that point, I think you called some of your ED friends, your super friends, and they said, well, based off of these criteria, you'll probably be admitted or they'll see you. But based off of, another set of criteria, they'll probably just send you home. Mm-hmm. So that's when we went out and I got a pulse ox.
Mm-hmm. That's when you got the pulse ox, which was kind of scary because the day before, that day actually, you couldn't find a pulse ox, remember? Because the pharmacy was closed. But then we ended up getting it the next day.
And shout out to independent pharmacies that are out there still.
Yeah, seriously.
Because I found it at an independent pharmacy,
Yep.
but I couldn't find it at any of the national chain pharmacies in our town. So shout out to those independent pharmacies that are out there
Seriously.
struggling to compete with the big national chains.
Yep. Because they really came through for that one. But yeah, I mean, at one point, my oxygen level, one night, I woke up, literally just walked to my bedroom to the bathroom, and I was huffing and puffing. And by the time I got back to my bedroom, I checked my pulse ox level, and it was at 76. And at that point, I was just like, okay, I need to take some deep breaths, just like we tell our patients, right? Sometimes you walk in, the pulse ox is low, and you tell your patient, take a deep breath. So just so that you can see whether or not they're taking shallow breaths. But I was literally huffing and puffing. So I knew it wasn't necessarily just me taking shallow breaths. Like, I could not catch my breath. And so it took about maybe up to a minute or so for my level to go up to 92. That's kind of where I was hanging out for a while, was at 92. But, for a couple of days there, I was literally at any point in time checking my pulse ox, and I was between probably 88 to the most, I think, was 94. And that's kind of where I was hanging out, but I just kept taking deep breaths and just going, okay, they're probably going to send me home if I go to the ED, because I'm probably just not so critical.
There's been a rash of people. I think they said in New York, there's been this surge of deaths at home, that quote unquote may be, heart attacks that we don't know. Maybe it is heart attacks, or maybe it's just people who are self-diagnosing, thinking that they do have COVID, or they have symptoms of COVID, but they're just saying, well, I'm okay. And then it progresses and they never make it to the hospital, and they're dying at home. So this is no joke, man. Thank you for sharing with that stuff. Yeah. For me, this lasted maybe about 3 to 4 days. And then for me, the biggest thing has been just this cough that I've had. And it's affected my voice, affected even the ability to make an episode, because I could not talk. Even doing this episode, there are times when I just can't carry my voice long enough before I have to cough. And about a week ago, or no, like 2 weeks ago at least, it was to the point where every other word I was just coughing. So that's why an episode hasn't been put out, because I couldn't even do intros for shows that I've recorded in the past. And so that's been crazy. So I think the worst was that one night where I had fevers I just had chills and body aches. I don't know if I had a fever or not, but you definitely took the brunt of this. So
yeah, man, my immune system, I don't know. I'm really hoping this thing confers immunity afterwards, because I'm like, I don't know if I can get reinfected. Like, this is bad, guys. This is bad. Like,
the people who do not need to be out, my advice is please stay home. Stay home. Social distance. If you're going out, make sure you're staying 6 feet away from people. Wear a mask.
Wipe everything down that comes into your house.
Yeah. Wash those hands until you become ashy.
Wipe those groceries down.
This is no joke. Like, this is really no joke. And, it doesn't discriminate, right? Whether you're a physician, whether you're someone who is high standing, or whether, whatever class you're in, everybody can be affected. And I'm someone who doesn't really normally get sick. Washing my hands, making sure that I'm wearing my face mask in the hospital, cleaning off the surfaces where I'm typing on computers, just wiping off and using all those different, chemicals to wipe off the computer, the desk, the telephone,
everything.
And, like I said, I don't know exactly where I got it, but I got it. I don't know if it was on a plane ride home, it was in the Uber, whatever it may be. I got it. And, it was tough. and we got through it though. So that's the most important thing. And I mean, we're just hearing reports of doctors who are our age, some of them even younger, who are getting it, passing away. Obviously, the ones who are catching this are the ones who are elderly or have some type of predisposed condition. So that's really unfortunate for them because it almost feels like they're like sitting ducks, so to speak, but this has been really unfortunate. And then also the young have been getting it also. So
fortunately, not too many children have passed away with this. So that's a good thing. But, talking about docs getting it and really just not faring well or dying, I really have a question as to whether or not doctors with pre-existing conditions or doctors over a certain age should be on the front lines with this. Like, I mean, there are a lot of things that need to be done, right? There's a lot of work that needs to be done, obviously. But my question is, should they really be putting themselves in such harm's way, being exposed, re-exposed to the point where we're actually losing lives on the front lines because of this?
Yeah, we've never seen anything like this before.
Never.
Right? Never seen anything like this, unless you want to say maybe HIV. But even back then, we knew how it was transmitted, right?
Well, eventually.
Eventually, we did. So I guess you can say the doctors who are on the front lines probably were risking their lives, but I still think that was a little bit different than now.
Because it's not aerosolized.
Right, it's not aerosolized. It's not aerosolized, and I don't know if the majority are catching it from aerosolized.
No, I'm talking about HIV is not aerosolized.
Right. So for me, it's just like this resets everything, right? We've never seen anything like this, and I know for a fact, I don't know for a fact, but I'm pretty confident to say that the majority of people who want to be on the front lines of taking care of people who are sick never thought that they would be,
of course not,
giving up their lives for this. Right. Also, like maybe they figure, okay, I'll be working mad hours, I'll be sacrificing some things, but I think the last thing that people thought in their minds is that I'm sacrificing my life for this.
Like, I'm going to go see this patient and 2 weeks later I will be dead. Literally that's what's happening.
Yeah, I think that's the part that most people are saying, look, I ain't signed up for this.
Right.
Like, I signed up, maybe I'll miss a wedding, I'll miss funerals, I'll miss my kids growing up, or I'll have some economic, hardship from this, but me losing my life over this, it's crazy. So I agree with you. Like, there's just some things that we all in general have to think about. And I think just in general, like, I've been talking with other doctors about this. I think, this whole pandemic has forced us to really do a full stop on how we are as a society. And I'm talking about the United States in specific, right? How we are as a society, how we're built, how we have certain inequities. And I'm going to even stop saying inequities. I'm going to stop saying disparities and just speak the truth and just say, we have a society where people don't get shit, and then there's a portion of people who get a lot of shit.
Yep.
Right. And I think sometimes when you say inequities or you say disparities,
it's so academic.
It's very academic, and it puts it's like saying Grey Poupon, right? It's like, damn it, like, let me get some mustard. Let me get some mustard, all right? You know what I'm saying? Like, I think that, we just have to be really open and honest and just say that, like, this is forcing us to put a microscope on, basically a deck of cards that this country is built on from a societal, safety net standpoint, right? And this is showing us that a couple of things. One, no matter what your station in life is, whether you're rich, whether you're poor, this pandemic, this virus is showing you that it does not discriminate, right? Yep. And that the way in which you are able to get ahead of this is by having, plans, having priorities that really focus on people who can't really fend for themselves first, right? So if you as someone who is of means are able to get testing and are able to, fend for yourself, but what about the millions of people who can't take time off, or the millions of people who can't have health care, or the millions of people who are in a situation where they can't protect themselves, like that is eventually going to affect you.
Absolutely.
And not in a very slow way, like very quickly, as we're starting to see with this pandemic. So I've had an opportunity to kind of think about things and just be like, man, like this is crazy.
Right.
And this stuff is built on a to me it just seems like it's a deck of cards.
Yeah, that's about to just topple over. I mean, like you said, there are, the haves and the have-nots, right? So people who have, people who don't have. And sometimes, I wonder if the people who have think like, well, I don't associate with people who don't have. It's like, no, you all associate with people who don't have. Eventually you will associate with someone who doesn't have, or you will associate with someone who does associate with someone who doesn't have. And we do not live in a bubble. As much physical distancing as you want to do, you don't live in a bubble. Eventually you will be exposed. You will be exposed. If you think about it, like something as simple as, chicken pox, back in the day, remember, everybody used to get chicken pox, right? Before the vaccine,
I never got chicken pox.
You never had chicken? Of course you had chicken pox.
I never had chicken pox.
Yes, you did have
no,
chicken
I didn't.
pox.
I never had chicken pox. How are you going to tell me? I never had chicken pox.
You never had chicken pox?
You would, like chicken pox you remember, right?
No, you don't.
Well, I remember
you don't remember chicken
I
pox.
remember
Most people were like 5 years old when they got chicken pox.
I remember my sister getting chicken pox, and I'm like, I never forgot that. I'm like, I'm glad I never got chicken pox.
Anyway,
I'd never had chicken pox. I had to get the vaccine, right? Thank goodness, but I have never had chicken pox.
Well, a lot of people got chicken pox back in the day, and it's just kind of like that. Like eventually, you're going to associate with a child and you're going to get chicken pox. Usually it was another child. Now with the vaccine, you don't really see chicken pox anymore, but it's like that. It's the same thing with the flu. I mean, eventually, people do come down with the flu, whether it's a mild flu or, whatever, but eventually you will associate with someone who has the flu and you will get it. I mean, this is kind of the same thing. And for me, I guess, I don't know. I guess I just don't understand the whole thing behind, some of the precautions that we are not taking, especially as healthcare workers, and not because we don't want to take the precautions, but because those precautions just don't exist for us, or they're not appropriate.
Oh yeah. I mean, there's so many different notes of the PPEs not being enough, and remember that report of nurses dressing in garbage bags because they couldn't find enough PPE.
I mean, seriously, for me, I'm like, remember the other day I asked you, I said, so if you didn't have the appropriate mask on, would you go in to a patient who is COVID positive? And you kind of hesitated, and before you could answer the question, I asked you, would you do surgery without gloves on? And you were like, no. I'm like, so well, what's the difference? What's the difference? Because after this, seriously, the precedent has been set. The precedent has been set. If you are not going to have appropriate protective equipment for COVID-19, then technically we should be allowed to do surgery without gloves, with our bare hands.
So remember what's that doctor's name?
Or with the blue gloves that you get on the wall.
What's the name of that doctor in our anatomy class? What's that thing he put on his hand?
Oh, was it Dr. Leg?
No, it wasn't Dr. Leg. It was so anyway.
Dr. Gale. Dr. Gale.
Yeah, I don't know. Either way,
I remember.
In our anatomy class in Kansas City, we had a professor who would put something on his hand. I wonder if it was parafilm or something like that.
Yeah, it was some.
There was some type of thing he would put on his hand, and then he would dig his hand right into a cadaver, and I'm like, what? I mean, there's like eating in front of eating in anatomy class, right? Because that's what I would do. And every time I see anatomy, I get hungry. But like putting your bare hands. But I think he must have had parafilm. So I don't know if they can do that for us.
Yeah, he used to put a protective something. Yeah, whatever it was, it must have been liquid, and then it hardened because it looked almost like a lotion that he would put on his hand, and then he would just go into a cadaver, and we were all like, what?
Yeah. But yeah, this stuff with PPE is a big issue.
The precedent has been set.
This is a big issue. People are practicing without enough protection.
Exactly.
Part of it is a hospital issue. Obviously, a big part of it is a supply chain issue, right? Which, from a federal government standpoint, we can talk for hours about this stuff. That's a major problem. That's a major issue. And this is what happens when politics gets involved with healthcare.
Exactly.
And
there's a lot of hoarding going on also.
Yeah, there's a lot of hoarding going on also. Here's the thing that I'm really, I'm really interested in is, some of the healthcare workers who have been either fired for speaking up, right? We heard about that physician who was fired for speaking up about not having enough PPE, or some of the nurses who have
been
suspended. Maybe they have a pre-existing condition. I've seen a lot of those on Instagram about nurses who've had pre-existing condition, whether diabetic or asthma, or something else, and are basically saying, no, can you put me on a different floor, or can you put me in a different set of patients, and them getting suspended or maybe even getting fired for that.
Or quitting.
Yeah, I think that we're in a different time. We're in a time when people are getting in trouble for speaking out, which really, really, I'm conflicted on how this is working, because this is a problem, right? Like we are in a situation where, we need all hands on deck, but also at the same time, we can't force people, to do things that are going to put them in harm's way. Like we have to be able to give people the free will to be like, look, like I see what's going on. I see the danger at hand. I can't do this.
Right.
I choose to get on the off ramp or whatever, or I choose to get off,
Well, and I know that some of this, some people are going to be like, no, but you're a doctor. That's what you signed up for. Because I'm seeing that in some threads. I
disagree
about residents.
I disagree with that. Yeah.
I disagree with it too.
Yeah, I disagree with that.
But I'm seeing that in some threads, especially about residents, and people going, well, that's what they signed up for and things like that. And I'm like, no, they did not sign up to give up their lives. There's nothing in our Hippocratic oath that says that you should give your life for a patient. And actually, I would argue that, those people who feel like, no, the Hippocratic oath says that you should go in and you should take care of patients no matter what. I would actually argue that that's not what it says. Because if you think about it, are you not putting other patients in harm's way if you go in without appropriate protective equipment?
Well, but I think those who are not in the medical field who make those type of arguments, obviously.
No, I'm talking about those who are in the
medical
field. Yeah.
Yeah.
I'm talking about those who are in the medical field making that argument. I mean, I literally
that's even more troubling.
Yeah, I'm reading posts about people going, about people saying that, residents, this is what they signed up for, and I'm like, residents do not sign up to give their lives. I'm sorry. But the oath does not say that you have to kill yourself in order to save a patient. It completely defies any sort of common sense. You have to have appropriate protective equipment, just the same way that you would not go in and, deliver a baby barehanded and then walk into another room and deliver another baby barehanded, is the same way you should not walk into a patient, especially known COVID positive patient, without appropriate protective equipment, and then walk into another room with a patient who you don't even know whether or not this patient is positive COVID or not. Like, that to me is irresponsible. It's just stupid. And I'm sorry if anybody's listening to this and you disagree with me, but I think that is stupid.
Yo, they coming after you. Yeah.
Well, let them come after me, because I think that's stupid and I think it's irresponsible. And I think that you should rethink being a doctor if you think that it's okay to go in without appropriate protective equipment. And I'm a firm.
Is that a hard stop?
That's a hard stop.
Is that a period after that?
You should stop being a doctor if you think appropriate medical equipment, protective equipment, is not necessary. You should stop being a doctor today. Quit. Turn in your license. I'm sorry. I'm through with that.
Apparently.
I'm through with that.
Well, look, here's the issue. Here's another issue that I think is really interesting is, hospitals have had, well, because the economy in general has slowed down, hospitals are not immune to the economy also, right?
Mm-hmm.
So, as a result, there's less surgeries. Hospitals aren't doing as many elective cases. So the quote unquote cash on hand, the cash reserves, hospitals have been bending through those or burning through that. And resultingly so, like some specialties or even some hospitals have had to, change the way their staff doctors work. They've had to decrease their pay. Some have been forced to go home.
I don't know if they've had to decrease their pay, but they did decrease their pay.
They decreased their pay, right? So, the question out there is, you got doctors who are, a lot of them are living paycheck to paycheck. Now, obviously, you can't compare the economic strife of a doctor compared to someone who's, 3 or 4 rungs down. But the question is,
it's the same effect.
It's the same effect, but it's a little different, right? They have a little bit of room and stuff. So
maybe. I mean, there are doctors who are like literally like if they don't get a paycheck, in 2 weeks, it's pretty much a wrap.
Okay. All right. I see where you're going with
That's
this.
what I'm just talking about the effect of it, right? Now I'm not necessarily talking about, assets, right? Because you could sell something. You could decide, okay.
Well, look, how about this? I'm not going into anybody's pockets, right?
Right.
I'm not going into any pockets, but I could probably say that the likelihood of someone starving, a doctor starving if they miss a paycheck versus someone who makes $10,000 a year and not receiving a check, right, is a little bit different.
Gotcha.
I may be oversimplifying things, but I'm just, you guys, everybody gets my point. Mm-hmm. All I'm saying is, in light of like the stimulus checks that are going out and like basically most doctors not being able to get that because that stuff gets phased out, for most doctors, what are your thoughts on that? My thoughts are, I think everybody should be getting a stimulus check. I mean, if you pay in,
exactly.
If you pay in, you should be getting some type of stimulus check because it's affecting everybody in every way.
Mm-hmm.
So, whether you are a doc who, it does mainly outpatient, you've been forced to do telehealth, or if you're a surgeon who does a lot of elective surgeries, like you can't do that anymore. I think, in some form or fashion, it has to be some type of hazard pay or something that's going to these docs,
Yeah, no, I agree with you. I mean, everyone is being affected. Just because you're a doctor and you're going into the hospital doesn't necessarily mean that you're not being affected. And just because you're a doctor in general doesn't mean that you're not being affected. Like you said, what if you are primarily a doc who is outpatient? Some places actually have just phased out their outpatient. Like they're not even doing outpatient at this point because all hands on deck, in the hospital. And
I know a doctor who was offered a position, given a contract, given a sign-on bonus, signed a contract with the sign-on bonus, and was literally a week away from moving to this new job. And the offer got rescinded. And I'm not sure exactly what's going to happen in terms of, because this person already got an apartment, in the new town, has a moving company coming to move them out. So what's going to happen in that situation, where,
he suffered damages.
He suffers damages, but what's going to happen in that situation where, because he was primarily an elective physician and they rescinded it because they said, look, we can't pay for this anymore. Mm-hmm. What happens in that situation? That's crazy.
Yeah. Yeah, it really is. It really, really is. And I mean, this is across the board, right? My brother actually works in IT, but he works for like one of the big labs. And they just laid off like a huge percentage of their people, on the lab side, on the IT side. Like they just laid off a lot of people, because nobody's sending out labs anymore. Everything is just COVID. Like the number of lab tests that have been sent out has decreased so much. So, I mean, this is all across the board that we're seeing this in medicine, down from doctors down all the way to, cleaning staff even, right? Because if you are the cleaning staff of the outpatient clinic, there's no outpatient clinic.
Yeah, it's
You know?
this is crazy, and
Yeah.
like I said, I think it just kind of rolls down to like this
Mm-hmm.
deck of cards that we've been rolling around with, right?
Yeah.
And I'm sorry, if some people may be listening and like, man, I really don't want to hear about this, and it's like, but I'm sorry, but like, as physicians, like we have to care about people, not just when they're in the hospital, right?
Mm-hmm.
We have to care about them afterwards. Also, we're the biggest advocates for them.
Right.
And there are just things that we see from minority populations being treated and being over policed, to suffering from disparities. I'm using that big
Said the
word,
word.
right? But suffering from disparities in healthcare, how they're treated in the hospital, to the lack of healthcare, to not even just minorities, but even people who have lower class status, right? Because ultimately it's a class issue also, right? People of certain classes not being able to enjoy some of the the healthcare benefits that other people have. Like, these things all get magnified now, right? And the virus doesn't give a shit.
Nope.
Right?
It does not care.
What station you are, and we're finding out that government matters.
Good government.
Good government matters, right? Government that plans, government that is not over politicized, government that believes in science, like those type of things work, right? When you look at other countries, and it's really hard to always look at other other countries and say, oh, they did this, when for the most part, outside of the United States and outside of some countries here and there in Europe, like, most countries are homogenous. They don't have different
Right.
ethnicities and all these different things. We're different in that respect. We just, we got a ways to go,
Yeah.
and
I
I
mean,
just,
at
I
the
just,
same
and I just
time,
hope that
though-
afterwards, and that's the point of this type of podcast episode, is that, look, like, we have to continue these conversations, right? Because if we continue to sweep things down the rug, first of all, we don't even know when we're coming out of this, right?
No.
People are talking about May. Before, it was April 15th or Easter. Now it's May 15th. Like, we could be woefully, underestimating this.
So many
We're talking about
months.
like July, September, August, October, what have you,
Next year.
Who knows, right? They're talking about the Olympics in 2021, right? So, while this is happening, this is the perfect opportunity to talk about these things, to talk about how, like, wherever you are, particularly those who can't afford it, like, they're the ones who need healthcare the most, affordable healthcare the most, because as we're starting to see, it doesn't matter, right? If you say, oh, I don't want them to have it, it's like, well, that's fine, but just know that you're going to get whatever you're going to get whatever they got, right? So
Exactly.
I don't know.
Exactly. I mean, this again just highlights the fact that, public health is a real thing. And I know that there are some out there who truly, just kind of like you said, just don't necessarily care that, well, people don't have health care, it's, they should work for it, or they don't deserve it, or well, then just let them die. And it's like, that's not the way this works. That's not the way this works. You throw a pebble into a lake, it ripples. It doesn't just sink, it ripples. And this is exactly what is happening. I mean, you have a virus that didn't even start in this country, and now we have more cases than the country of origin.
And they have more people than we do.
Exactly. And they have more people than we do. Now, I understand, like you said, yes, it's a more homogenous, China's definitely more homogenous, but at the same time, we still have more cases. So, there is something to be said for the fact of, how our government is structured or not structured at this point. There's something to be said about how people are reacting to this. There's something to be said about people's, behaviors and why people are behaving the way that they do. I posted something, recently, because everybody's like, just stay at home. I don't understand why these people can't stay at home. I get that. People do need to stay at home. But there are people who actually can't stay at home. because it's more dangerous to stay at home than it is risking your life getting coronavirus.
If you have domestic violence in your house.
If you have domestic violence,
if you live
sexual abuse.
If you live in the neighborhood, like if you live in a projects, or if you live in a small apartment complex and there's like 6 or 7 people in the house, it's just like you need to get out. And you
live on a 17th floor, you need air. You got to get out. Yeah. You got to get out. Now, I'm not saying, get out and just, do you and all this kind of stuff. Obviously, you still need to do it responsibly, but at the same time, not everybody can stay home. Like, I think we've just come to a point in society where we don't care about anybody else's situations but our own. We really don't. Everything is about, well, you are poor because you deserved it.
Well, everything is cash rules everything around me.
Of course.
Right? Cream, get the money.
Yeah.
Right. And basically, if you're poor, it's because you're shiftless. It's because you're lazy, which we know is far from the truth.
Right.
Right. We know that's far from the truth, but that's the decades long, that's the century long explanation that if you're poor, it's because you choose to be poor and you're lazy.
Yep.
And I think that's unfortunate.
Yeah, it's very unfortunate. Because I think most people would not choose to be poor. And I know that there are people listening to this podcast who probably, again, you guys disagree with that. That's a different discussion.
If you disagree, shout us out, yo. Hit us up on Instagram. Hit us up on Facebook or Twitter. Let us know what you think.
Yeah.
Have this conversation.
But
I'm willing to debate you, yo. Actually, I think Dr. Renee is willing to debate.
I love a good debate.
You coming with the fire, yo.
I love a good debate. No, but I mean, that is to say, regardless of why you think people are poor, the point is that people are poor, and you really need to just meet people where they are, right? Like there is such a thing as realizing what your situation actually is versus, trying to navigate in a world of where you think your situation should be. Your situation is not that. If there's a river to be crossed, you can't pretend that it is not there. So you just need to either build a bridge or you need to stay on shore.
Or you could deny it.
You could deny it, but you'll drown. Just like that preacher who said he could walk on water and then promptly drowned right in front of his congregation. Okay, so he could either have dealt with the situation as it was, dude, you can't walk on water and you can't swim, okay? Or you should have stayed on land, but he died. So, I mean, this is where we are right now, and we need to deal with our situation as it is. And the reality is, if you don't deal with the healthcare issues, of the lowest, quote unquote, the lowest of us, then, the ones who are not so low, those who are in a higher class, you will suffer. You will not have workers to work in your, in your factories and in your stores and in your businesses. You will not have that.
So I think that, there's this talk about, forgiving student loans.
Mm-hmm. I've heard
and
that.
Not every doctor has student loans.
Correct.
But there's a talk about forgiving some student loans and some hazard pay. I do think that as part of the quote unquote stimulus, that there should be some type of hazard pay or maybe some type of loan forgiveness. Because I think that for people on the front lines, there is a huge sacrifice. Mm-hmm. For what's going on right now.
Well, especially in light of the fact that they're not getting money from the stimulus.
Right. I think that there should be some type of monetary something, mm-hmm. And I just feel like, if there's something to be given to small businesses, right? Mm-hmm. And to some people describe it as a slush fund or what have you. Shout out, first of all, for the PPP program, for those who are listening right now, make sure if you have a small business, if you are a private practice, if you are a locums doctor, if you focus on real estate, whatever it is from a small business standpoint, make sure you look into these, the CARES Act, particularly the PPP. There's an emergency loan program. I forget the full name of it, but make sure you look into these things. These things are something that you guys shouldn't scoff at. These are big deals. They're running out of money quick, so make sure you put in your application. And just remember, this happened. The government did something like this, but it wasn't as well advertised, but this happened back in Katrina, where a significant amount of money, I think it was from FEMA or whatever, from the federal government came down. And because so many people had left New Orleans and were scattered throughout the country, or people just weren't paying attention, there was a lot of people who missed out on getting monies that they really would have benefited. Like, they were from New Orleans, they may have had a small business and they bounced, or whatever it may be. They bounced and they were not able to get the money. Right. The proper people were not able to get the money. So please, y'all, if y'all listening, make sure you take those programs seriously. A lot of you physicians, like I said, who have small businesses,
would benefit.
You definitely would benefit from it. And if you're a private practice, and you've got, obviously you've got office staff, this may be an opportunity to keep people on your payroll a little bit longer without them having to file for unemployment.
Right. Mm-hmm. Yeah.
But yeah, so look, let's wrap this up, right? Let's wrap this up because, obviously I had to take a 2-week break because I couldn't talk to the point where it wouldn't be distracting to the audience, and you were a little bit sicker than I was. So obviously we're doing okay. We're back to working. We've done the proper, clearance. We've gotten cleared by, respective employee healths, and so forth. But I think that as physicians, I think it's part of our due diligence to make sure that, when we see something that will affect our patients in a way that's not just clinical, but in a way that can eventually end up being clinical, I think we have a responsibility to say something.
Absolutely. Absolutely. I mean, this is no different than anything else that we do except for the severity, right? And the rapidity, I guess.
The habitualness?
No, not the habitualness, but with the rapid nature of
habitually
of how people are affected, right? I mean, this is not any different than anything else that we do. We have to literally just do what we know works. Like, that's as simple as it is. Let's just do what we know works in terms of protecting ourselves and protecting our patients. It's bad enough that this virus is so new that we don't actually know everything that works currently in terms of curing our patients, right? In terms of treating our patients. It's bad enough that we have, that learning curve to get over. To create something, to create something new, a learning curve that doesn't need to be creative that needs to be created in terms of PPE, I think is just ridiculous. I mean, we've got people, putting masks together with yarn. I'm like, are you kidding me? Yeah. Like, what's going on here?
But look, the most important thing is look, guys, you got to do it for your abuela. You got to do it for grandpa.
Don't even get me started.
You got to do it for big mama. You gotta
Please don't.
You got to do it for granddad. Pop.
Don't get me started with this.
How do you in Creole? How do you say granddad?
No, I'm not even going to dignify that. I mean, it just bugs me. He is going to be in the same ranks as David Satcher, who I admire.
Before we even go into that tangent,
that's
I just thought I wanted to bring that up. But y'all, listen, y'all need to stay safe. Make sure you're washing your hands. Make sure you are staying 6 feet away from people and docs, man. We really and nurses, everybody who's on the front lines, from techs to the unit clerks to
Absolutely.
Maintenance workers to housekeeping, triage staff. We appreciate everything that y'all are doing. Y'all are heroes. Keep up the great work. And listen,
demand PPE.
Yeah, and the other thing too is after all of this is said and done, you guys got to keep your voice out there. You got to keep talking about things, because eventually what's going to happen is this is going to fade away. And y'all are not going to be on TV as much as y'all are on TV, or y'all are not going to be invited to podcasts or all these different things. But we got to keep the pressure on. So keep talking, keep tweeting, keep going on podcasts, keep going on TV, and being honest about what's really going on out there. Not just from in the hospital, but also some of the societal things that affect us clinically also. So with that being said, we're going to check out. So, Dr. Renee, what say you?
Demand PPE. That no, I'm so serious. We are human beings. We are human beings, and we should be treated with dignity. We should be treated with dignity, and it should be understood that we are people and we have families and we have people who depend on us. We are human beings, and damn it if I'm going to, have someone disrespect my existence because they want to save a dollar. It's not going to happen. So, docs, nurses, everybody on the front lines, demand PPE because it is there. It is out there. Some of it is being hoarded, and you guys know that. So demand PPE and you will get it, just like those nurses who eventually got their PPE.
So yeah. So we're gonna let you have the last word. Take us out. So with that being said, guys, we only got one life. Let's make it count and live outside the box. I'll catch you on the next one, guys. Peace.